How do you describe someone's personality? You would generally describe your teacher as intelligent or a friend as kind. An individual's personality encompasses the unique set of behaviors or traits that make them who they are. However, sometimes an individual's personality can be harmful, as they can hinder their day-to-day personal or work life. This is a personality disorder. The DSM-5, a manual for mental disorders, lists 10 such disorders that can be classified into 3 clusters: Cluster A, B, and C. Cluster A personality disorder is defined as individuals exhibiting odd or eccentric behavior. Cluster B behavior often encompasses a dramatic, emotional, or impulsive personality characteristics. Anxious or fearful behavior is often a hallmark of Cluster C personality disorder. We will focus on narcissistic personality disorder, which is a part of Cluster B. The term narcissism is derived from the Greek myth of Narcissus, which you might have heard of. Narcissus was a young man who disobeyed his mom's warning to never look at his own reflection. Unfortunately, he could not resist the temptation and drowned as a result of falling in love with his own reflection. Narcissistic personality disorder is characterized by individuals having a grandiose sense of self-importance. It may seem like they're acting out a part to get attention and may even risk being in dangerous situations to do so. These individuals usually regard themselves as the most attractive, intelligent, and talented people and look down on everyone else. However, behind this mask of excessive self-confidence is a truly low worth of self-esteem. These individuals are highly vulnerable to any sort of criticism. Narcissists tend to act selfishly as they put their needs before that of others. The causes of narcissistic personality disorder can be attributed to a variety of factors, from genetics to childhood abuse and trauma. NPD is known to affect 6.2% of the population, with men being affected more than women. Psychologists distinguish narcissistic personality into 2 broad subtypes: grandiose and vulnerable narcissism. The root cause of both is an extremely low worth of self-esteem. Grandiose narcissism is generally characterized by possessing traits like dominance, extroversion, and seeking attention. Individuals who exhibit grandiose narcissism are manipulative in their pursuit of power and lack any remorse. They make up for their low self-esteem by creating an exaggerated sense of superiority and uniqueness, as well as by engaging in grandiose fantasies. Such individuals will commit violent criminal acts in order to gain admiration from others, display extreme rage reactions to criticism, and are sadistic without experiencing remorse or empathy. Vulnerable narcissists are shy and reserved. They also have a strong sense of entitlement, but they are easily threatened. They make up for their low self-esteem by engaging in antisocial behaviors to protect their image. However, these individuals experience extreme shame in the process of doing so. NPD often groups a number of traits that show up together regardless of the diagnosis. Ted Bundy, the infamous serial killer, was not diagnosed with the disorder, but exhibited many of the traits. However, in order to meet the diagnosis, you need to show 5 of the 9 diagnostic criteria. 1. Lacks empathy, as they are unwilling or unable to identify the feelings or needs of others. 2. Shows arrogant, haughty behaviors or attitudes. 3. Is often envious of others or feels others are envious of them. 4. Is exploitative, takes advantage of others for personal benefit. 5. Has a sense of self-entitlement, unreasonable expectations of favorable treatment. NPD presents itself differently in different individuals. As a result, treatment options also vary. While there is no cure for the disorder, the most common treatment has been psychotherapy. Transference-focused psychotherapy is a more recent approach for patients with NPD. The ultimate goal of TFP is the integration of unintegrated representations of self and others, and to assist the patient in tolerating negative effects such as aggression, envy, and anxiety. The treatment process in TFP with narcissistic patients is similar to the one conducted with borderline patients. However, flexibility is an important goal of therapy, especially in the treatment of patients with NPD. Therefore, clinicians must alter their treatment strategies to better suit the needs of the patient. NPD remains one of the least studied personality disorders. Its exact causes are unknown, and its manifestation in people varies. Personality disorders can be harmful, as they can hinder the day-to-day personal life or work of an individual. Narcissistic personality disorders, from a social point of view, are seen as dysfunctional. Transference-based psychotherapy is the most recent form of therapy best available until further research discovers improved treatment methods. To learn more about NPD, check out the following link.